Good morning everyone. Today we are discussing about the surface marking of the sciatic nerve. As we know, sciatic nerve is the chief nerve of the body. It is the largest nerve which arises from the lumbar plexus, and it is the thickest nerve of our body. Generally, sciatic nerve, it consists of two components. It has a tibial component and a peroneal component. This sciatic nerve arises from the lumbar plexus, from the ventral rami. Ventral rami from the L4 to S3 segments of the spinal segments. For the surface marking of the sciatic nerve, we have to draw 3 points. First point is a line drawing vertically from the posterior superior iliac spine. Roughly, this is the PSIS, posterior superior iliac spine. From this is the ischial tuberosity, vertical line drawn here, and 2.5 centimeters, around 1 inch from the midpoint, approximately here. This is the first point. Then a second line drawn obliquely from this ischial tuberosity to the greater trochanter of the femur, obliquely, and the midpoint between them is the second point. And the third point is a junction between upper 2/3 and the lower 1/3 of the thigh, which is roughly approximately here. This forms its third point. Then by joining these lines, we can find out the course of the sciatic nerve. Since it arises from the ventral rami of the brachial plexus, it enters into the gluteal region by passing through the sciatic foramen. It enters the gluteal region. It is covered in the gluteal region by the gluteus maximus muscle, which is the largest muscle of the gluteal region. Then it descends downwards laterally, enters into the posterior compartment of thigh, reaches the third point, which is a junction between upper 2/3 and the lower 1/3. At the apex of the popliteal fossa, it divides into tibial part and the common peroneal part. Common peroneal part, it hooks around the neck of the fibula, and it divides into the deep and superficial peroneal nerves.
This is the course of sciatic nerve. At the superior angle of popliteal fossa, it divides into a tibial component which continues beyond the posterior compartment of the leg. The common peroneal nerve, it hooks around the neck of the fibula, dividing into a deep and superficial peroneal nerve. Deep peroneal nerve enters into anterior compartment leg. Superficial peroneal nerve enters into the lateral compartment of the leg. So if you see sciatic nerve, there is a possibility that the roots of origin of sciatic nerve, L4, L5, S1, S2 and S3, the roots may get compressed. So it results in a condition called sciatica, where there will be tingling, numbness and kind of pain sensation throughout its course of distribution, means throughout the lower limb. Okay. Not only that, there is a muscle called piriformis muscle. So it lies immediately underneath that key muscle or piriformis muscle. So whenever it gets compressed over there, it results in piriformis syndrome. The clinical features will be little similar to that of our sciatica. Okay, so this is the thickest nerve in the whole body. So this is its importance. And during intramuscular injections, while giving intramuscular injections, our gluteal region is actually divided into 4 quadrants.
Yes.
Upper and medial, upper and lateral, lower and medial, and lower and lateral. We should ideally give intramuscular injections to
The lateral quadrant.
Here we can give it. So if at all we give it in lower compartments, there is high probability that you may end up injuring the sciatic nerve. Okay, thank you. This is the clinical signal.